What's up, you guys? My name is Miguel, fellow Xray Tech here, giving you the knowledge you need. So today we're covering X-ray Tech School versus the nurse school. So to give you an overview, I'm an X-ray tech, and my lady is a nurse. We both graduated from the same school. Now, because I know you clicked on the video and you just want X-ray school is way more easier than nursing school. If you just want straight to the point, there it is. Now, we'll get into details of why. So, let's cover the clinical aspect of it, right? So, from clinicals wise, I spoke to my lady and I just curious, because we were she was finishing her nursing degree when I just barely got into my X-ray. So, I would ask her like, okay, so how's your clinicals? Because, I was curious how the clinical aspect worked, since we're both in the field. And she would tell me that sometimes she would have school from like the morning all the way to the afternoon and then had to drive to her clinical site and then find her patients' informations for charting drugs and other stuff like that, and we'll have to memorize all the medications and stuff they had to do. Come home, memorize it, and by the morning, or check off, or whatever they call it, they will have to recite and say all the drugs and all the stuff like that, so they can give the medicine, supervised by, an actual nurse or their instructor, which that's another thing. Their instructor's always there, which ours, depending on your facility, your school, ours wasn't there. That was a lot of memorization. And they would have to go up there, know their notes, know a bunch of things prior. Compared to us, literally, you don't have to do that. Like, you just show up, and you're like, okay, you're in the main X-ray department, you're in this department, you're in that department. Patient comes in, you really don't have to know much of them. All you have to know is if you're giving contrast, are they allergic to contrast? Have they had contrast before? That's about it. If they're pregnant, they're not pregnant. You don't have to know like all the medicine. Well, some medicines you do because some have reactions like blood thinners. So you have to know a little bit, but it doesn't compare to having to go in the day before and do all that. And they're very strict on their dress code of everything they have to do. Ours is too, but not as to the degree of if you don't have something, they'll send you home. Ours, like maybe if you don't have your dosimeter, you'd probably get sent home. Or if your teacher was there and you weren't on uniform, But theirs was way more stricter on everything you had to have, and a lot stressful, I would say, as far as. Because our checkoffs would be, you go in there with an X-ray tech, okay, you shoot a chest X-ray, and then you did it all by yourself, and they're like, okay, we'll sign it. And then theirs, they had to perform theirs usually with their instructor being there. And if most of the time when you're doing what we call, in our school they called show me's, where you would do an X-ray, pretend one on your other X-ray students, to show that you know how to position them and all that. So that was very nervous. So I'd understand why you would get nervous. You're out there with the actual patient and your teacher's there, and that wants everything by the textbook. That's another kind of higher stress thing. And they do way more than we do. Like, as far as job wise, like my lady comes home stressed every single day about all the stuff she's done and about all the stuff that she has tomorrow. And I'm like, I go there, do X-rays. Once I leave, I'm done. Like, I'm not stressed about anything. Yeah, maybe if you lose like a patient while you're shooting them or something like that, or other stuff. But like, for the most part, I'm not stressed. I come home not really that stressed. And the pay, I would say, between us right now, I make more money because I'm doing nights. But like the pay is, yeah, you probably make more money being a nurse. But for the amount of stuff you're responsible, liable, and all the other notes, and if they get hurt, there's so much, way more stuff they have to do. Which, once again, I respect so much my lady or any nurse who does that compared to our degree. Because ours is, they think we're button pushers. But it is easier compared to being them. As far as benefits goes, kind of the same. The hospital kind of she gets more treated special as in like the doctors, during holidays, bonus, stuff like that. Because sometimes the nurses you'll have one doctor you kind of work under, and ours we just have rads, which some of the time you don't even see them because you're just reading from home. I mean, let's see what else. They have a lot more school stuff. Like, I think mine, we were taking like 2 or 3 classes and then clinicals. They have a lot more classes to take, and they have a lot more checkoffs. They have it's a lot more stuff they have to do, and like, I would be there peeping and seeing what stuff, homework and all that. It's I would say it's a lot more than us. Even though when I went through my program, I felt like it was a lot, and I'm like, well, there's no way I would have been able to make the nursing place. Yeah, it's kind of stressful. And they have the NCLEX, and even their boards. Even their boards is way more than ours. Like, as far as like stuff you need to know, they have a lot more stuff they have to know than we do. So, I personally am thankful I'm an Xray tech because there's, I'm the smartest person, but I made it, and as far as job wise, well, they do usually most colleges. There's a lot of more colleges that offer a nursing degree compared to Xray degree, so and they have what's it called? They accept more students into the program compared to ours. But depending, some places will have a higher turnout. Like, they have more people that, like, let's say they accept 50, and then by the end there's only like 20. And then ours, like, we started with 20, ended up with 15. So, I know. But I think it's. I love bones, so I'm thankful I chose this one. It was easier for me and way less stress. But once again, if you love being a nurse, you love a lot of patient care, you love doing, all that, and it makes you happy, by all means, be a nurse. But I'm thankful in Xray Tech. I ain't trying to be biased. I'm just, trying to help you out if you're there, kind of on the borderline on stuff. And yeah, see you in the next one.